An ear infection, often referred to as acute otitis media, occurs when the middle ear, the air-filled cavity behind the eardrum housing the small vibrating bones, becomes infected. This condition is more common in children than in adults. During an ear infection, the eustachian tubes, which connect the middle ear to the upper part of the throat, can become inflamed and obstructed. This blockage can cause mucus to accumulate in the middle ear. If this mucus becomes infected, it can result in the symptoms associated with an ear infection. Symptoms. The signs and symptoms of an ear infection tend to develop quickly. Common symptoms in children include ear pain, especially when lying down, pulling or tugging at the ear, difficulty sleeping, increased crying, irritability, difficulty hearing or responding to sounds, loss of balance, fever of 100 Gironati to 38 Tarni or higher, fluid draining from the ear, headache, reduced appetite. Common signs and symptoms in adults include ear pain, fluid drainage from the ear, hearing difficulties. When to see a doctor. Ear infection symptoms can signal various conditions, so getting a proper diagnosis and timely treatment is essential. Contact your child's doctor if symptoms persist for more than 24 hours. A child under 6 months old exhibits symptoms. Ear pain is severe. An infant or toddler remains restless or irritable following a cold or upper respiratory infection. You notice discharge, pus, or blood coming from the ear. Causes. An ear infection occurs due to bacteria or viruses in the middle ear. This infection is often a consequence of another illness, such as a cold, flu, or allergy, which leads to congestion and swelling in the nasal passages, throat, and eustachian tubes. Middle ear. The middle ear houses 3 small bones, the hammer, malleus, anvil, incus, and stirrup, stapes. These are separated from the outer ear by the eardrum. Role of eustachian tubes. Eustachian tubes link the middle ear to the throat, regulating air pressure, refreshing air, and draining secretions. Swollen tubes can block, causing fluid buildup and potential infection. In children, these tubes are narrower and more horizontal, increasing the risk of blockage. Conditions affecting the middle ear that may be linked to an ear infection or cause similar issues include otitis media with effusion, swelling and fluid buildup in the middle ear, without a bacterial or viral infection. This can occur if fluid remains after an ear infection has cleared or due to eustachian tube dysfunction. Chronic otitis media with effusion, persistent fluid in the middle ear that recurs without infection. This condition can make children more prone to new ear infections and can affect hearing. Chronic suppurative otitis media, a persistent ear infection that doesn't respond to typical treatments, potentially leading to a perforated eardrum. Risk factors. Factors that increase the risk of ear infections include age. Children aged 6 months to 2 years are more prone to ear infections due to their eustachian tubes' size and shape and their developing immune systems. Group childcare. Children in group settings are exposed to more infections, increasing the likelihood of colds and ear infections compared to those cared for at home. Infant feeding. Babies fed from a bottle, especially while lying down, have a higher risk of ear infections than breastfed babies. Seasonal factors. Ear infections are more prevalent in the fall and winter. Seasonal allergies can also elevate the risk when pollen counts are high. Poor air quality, exposure to tobacco smoke, or high levels of air pollution can increase the likelihood of ear infections. Alaska Native heritage. Ear infections are more common among Alaska Native children. Cleft palate. Children with cleft palates may have difficulties with eustachian tube drainage due to differences in bone structure and muscle function. Complications. While most ear infections do not lead to long-term issues, recurrent infections can result in serious complications. Impaired hearing. Mild temporary hearing loss is common during an ear infection, but usually resolves after the infection clears. Repeated infections or persistent fluid in the middle ear can cause more significant hearing loss. Permanent damage to the eardrum or middle ear structures can lead to permanent hearing loss. Speech or developmental delays. Infants and toddlers with temporary or permanent hearing impairment may experience delays in speech, social, and developmental skills. Spread of infection. Untreated or poorly responding infections can spread to nearby tissues. This can lead to mastoiditis, an infection of the mastoid bone behind the ear, which can cause bone damage and pus-filled cysts. In rare cases, severe middle ear infections can spread to the skull's tissues, including the brain or the membrane surrounding the brain, meningitis. Tearing of the eardrum. Most eardrum tears heal within 72 hours, but some cases may require surgical repair. Prevention. To reduce the risk of developing ear infections, consider the following tips. Prevent common colds and other illnesses. Encourage your children to wash their hands frequently and thoroughly. Avoid sharing eating and drinking utensils, and cough or sneeze into their elbow. Limit time spent in group childcare, opting for settings with fewer children when possible. Keep your child home from childcare or school when they are ill. Avoid secondhand smoke. Ensure that no one smokes in your home and choose smoke-free environments when away from home. Breastfeed your baby. If possible, breastfeed your baby for at least 6 months, as breast milk contains antibodies that may protect against ear infections. Proper bottle feeding. When bottle feeding, hold your baby in an upright position and avoid propping the bottle in their mouth while lying down. Do not place bottles in the crib with your baby. Discuss vaccinations with your doctor. Consult your doctor about appropriate vaccinations for your child. Seasonal flu shots and vaccines for pneumococcal and other bacteria can help prevent ear infections. Diagnosis. A doctor can typically diagnose an ear infection or other related conditions based on your symptoms in a physical exam. The doctor will likely use an otoscope, a lighted instrument, to examine the ears, throat, and nasal passages. Additionally, the doctor may use a stethoscope to listen to your child's breathing. Additional tests. If the diagnosis is uncertain, the condition has not responded to treatment, or there are other long-term or serious issues, your doctor may perform additional tests. Tympanometry measures eardrum movement to assess middle ear pressure. Acoustic reflectometry evaluates sound reflection from the eardrum to detect fluid in the middle ear. Tympanocentesis drains fluid from the middle ear for testing if infections persist. Other tests, referrals to specialists for hearing, speech, language, or developmental assessments if multiple ear infections or fluid buildup occur. What a diagnosis means. Acute otitis media, commonly known as an ear infection, this diagnosis is given when fluid is present in the middle ear. There are signs or symptoms of infection, and the symptoms have started suddenly. Otitis media with effusion. This diagnosis is made when there is fluid in the middle ear, but no signs or symptoms of infection. Chronic suppurative otitis media. This indicates a long-term ear infection that has caused a tear in the eardrum, often with pus draining from the ear. Treatment. Some ear infections can resolve without antibiotics. The best approach depends on factors such as the child's age and symptom severity. A wait-and-see approach. Symptoms of ear infections often improve within a few days, and most clear up within 1 to 2 weeks without treatment. The American Academy of Pediatrics and the American Academy of Family Physicians suggest a wait-and-see approach for children 6 to 23 months, mild middle ear pain in one ear for less than 48 hours in a temperature below 102.2 F, 39 C. Children 24 months and older. Mild middle ear pain in one or both ears for less than 48 hours in a temperature below 102.2 F, 39 C. While antibiotics can be beneficial for some children, overuse can lead to antibiotic resistance. Discuss with your doctor the benefits and risks of using antibiotics for ear infections. Managing pain. Your doctor may recommend the following treatments to alleviate pain from an ear infection. Pain medication. Over-the-counter acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, can help relieve pain. Follow the directions on the label. Avoid giving aspirin to children or teenagers recovering from chickenpox or flu-like symptoms due to the risk of Ray's syndrome. Consult your doctor if you have concerns. Anesthetic drops. These can be used to relieve pain if the eardrum is intact without any holes or tears. Antibiotic therapy. After an initial observation period, Your doctor may recommend antibiotics for an ear infection in these cases. Children 6 months and older with moderate to severe ear pain in one or both ears for at least 48 hours or a temperature of 102.2 F, 39C or higher. Children 6 to 23 months with mild middle ear pain in one or both ears for less than 48 hours and a temperature below 102.2 F, 39C. Children 24 months and older with mild middle ear pain in one or both ears for less than 48 hours and a temperature below 102.2 F, 39C. Children under 6 months with confirmed acute otitis media are more likely to be treated with antibiotics immediately, without waiting. It's important to complete the full course of antibiotics as prescribed, even if symptoms improve. Stopping early can lead to recurring infections and antibiotic resistance. If you miss a dose, consult your doctor or pharmacist on what to do next. Ear tubes. If your child experiences recurrent or long-term ear infections, chronic otitis media, or persistent fluid buildup after an infection, otitis media with effusion, the doctor may recommend ear tubes. Procedure: myringotomy. Process: a surgeon makes a small incision in the eardrum to drain fluid from the middle ear. Tympanostomy. Tube: a small tube is placed in the opening to ventilate the middle ear and prevent fluid accumulation. Duration: some tubes stay in place for 4 to 18 months and fall out naturally, while others may require surgical removal. The eardrum typically heals and closes up after the tube falls out or is removed. Tympanostomy tubes: small cylinders, plastic or metal, surgically inserted into the eardrum. Create an airway to ventilate the middle ear and prevent fluid buildup. Treatment for chronic suppurative otitis media: persistent infection with a hole or tear in the eardrum. Treated with antibiotic ear drops, possibly requiring fluid suction before application. Monitoring: children with frequent ear infections or persistent fluid need close monitoring. Regular follow-up appointments and hearing and language tests may be recommended. If this video was helpful, please like and subscribe.